Karthik, physician and diabetologist practicing at Narayana Health and Clinic Health Tree. Today I'll talk about hypertension, the risk factors, the effect of hypertension on body, and what are the things that you can do to prevent those. What exactly does hypertension mean? Basically, when the blood flows through the blood vessels, it exerts a lateral pressure on the walls of the blood vessels. With what pressure the blood flows is what determines how much blood pressure one has. So it has two parameters. One is the systolic blood pressure and diastolic blood pressure. So normally the blood pressure will be in a particular range for individual. If it continues to remain higher than the normal for a longer period of time, then we consider it as hypertension. So usually the blood pressure can fluctuate based on the events what you're following. For example, if you're running, if you're walking, the blood pressure may temporarily be a little high. If you're anxious, if your sleep is less, the blood pressure may temporarily be high, but eventually the blood pressure has to fall back to within the normal range within a couple of hours. So if the blood pressure tends to remain on the higher level for more than required duration, that is when the damage because of the blood pressure can happen on the internal organs of the body. So what exactly are these, the damage what I'm talking about? Basically, when the blood pressure is high, it can cause damage to the eyes, causing retinopathy. It can cause damage to the kidneys, causing nephropathy. It can cause damage to the heart, causing something called as a cardiomyopathy. It can put a person at risk for stroke as well as ischemic heart events, that is heart attacks. Apart from this, hypertension also is known to be involved in other morbidities like arrhythmias, heart beating irregularly, and sudden cardiac deaths. What are the symptoms of hypertension? Basically, many of times if there is a very subtle rise in the blood pressure, there may not be any symptoms as such. If the blood pressure is just maybe 4 or 5 millimeter above the normal range, the person may have very vague symptoms or even no symptoms at all. But as the blood pressure tends to be on the higher side, the symptoms of blood pressure tend to show up. These can vary from let's say a headache, giddiness, fatigue, irritability, loss of consciousness, giddiness. These are the most common symptoms of high blood pressure. And how does one identify blood pressure? So basically, if you have a home BP apparatus, you can monitor in the blood pressure monitor at home, or if you have a nearest clinic, you can just go drop down and they can check the blood pressure for you. Coming to the risk factors, who are all at risk for developing hypertension? So as a person ages, their blood vessels tend to thicken, they tend to stiffen a bit, and there can be calcium deposits in the blood vessels. These are the risk factors for developing high blood pressure. So age is one of the common criteria. As a person ages more than 60, 65, the chances of or the incidence of hypertension is more common in elderly compared to the younger person. So if you are over the 50 years of age and you have never checked the BP, it's high time you check the BP now. Second is a family history. If there is a family history of hypertension, especially a hypertension at a younger age in the parents or siblings, then the individual is at risk of developing hypertension. So if you have a strong family history of 1 or 2 individuals in your immediate family members who are having high blood pressure, it's high time that you check your BP as well. Other thing which can contribute to blood pressure is sedentary lifestyle. If you're in a occupation which doesn't need to be constantly on exercise or more of sedentary sitting lifestyle, this puts a person at risk for hypertension. Smoking can increase the blood pressure, and smokers are known to have high blood pressure than non-smokers. Increased processed food intake, increased salt intake, these are other reasons where blood pressure can be on the higher side. Apart from this, type A personality or extremely stressful person, they are also at increased incidence of developing high blood pressure. Okay, so now we understood the symptoms of hypertension. So what do we do when we get diagnosed with hypertension? So we look at it from two different ways. One is a non-medical and second is a medical treatment. So in non-medical way, what we can do is basically shift to something called as a DASH diet. DASH diet is basically the food rich in antioxidants, less processed food, whole grain based food, increase almonds, walnuts in the diet, and exercise regularly. Shifting over to low salt diet and DASH diet can reduce a person's BP by around 5 to 7 millimeter, and exercising at least 30 to 45 minutes per day can again reduce the blood pressure by 5 to 7 millimeter. If a person is overweight, reducing the weight by 5 to 10% of the body weight can again reduce the blood pressure by around 5 to 7 millimeter. So doing all these three things together, that is weight reduction, low salt intake and exercise, can actually help the person to reduce the blood pressure by 8 to 10 millimeters without any need of medications. However, what we have to understand is each person is different. It may not be universal. Some people can have a better results compared to others. So it's always best to make sure that you check your BP regularly. If the blood pressure is not into target range, you'll have to be on medications. So another commonly asked question is, once I start with the blood pressure medicine, should I take it for lifelong? How long should I take it? What happens if I stop it? What happens if I skip it? So we'll address each of it one by one. So the blood pressure medicines are always to be taken on a regular basis. So most of the blood pressure medicines have a fixed half-life, meaning they work for a fixed number of period. Once the period elapses, the effect of the medicine starts deteriorating and the person's blood pressure may start to go higher and higher. So it is very important that the person tends to take the medicines regularly at a regular intervals as prescribed by the doctor. So in case you forget the dose of medicine, you can take it whenever you remember to take the medicine. However, if more than one day has elapsed since the time you missed the medicine, you can continue with your regular dose of the medicine from the next day onwards. It has to be understood that the blood pressure medicines are not curable and it is only meant to control the blood pressure. So it controls the blood pressure as long as you take the medicine. So it is very important that you tend to continue with the medications till the time your doctor advises you to continue with the medicines. In case the blood pressure tends to be on the lower side, we may ask you to taper down the medicine or keep a watch on the blood pressure, and if needed, we can try to taper it down. If the blood pressure tends to be on the higher side, we might have to up-titrate the dosage as well. So what are the tests to be done when you get diagnosed with high blood pressure? So predominantly, as I was mentioning earlier, the blood pressure can have a bearing on the heart, have a bearing on the kidney, has a bearing on the eyes. So the first thing what we have to understand is whether the damage has already occurred or not. So we have to check the eyes to look for a retinopathy. Then secondly, we look at a kidney function test to get a baseline valuation of your creatinine as well as albumin-creatinine ratio. Thirdly, we look at your heart to look at ECG and echo to see if there is any damage to the heart because of the blood pressure. If none of the damage has occurred, that's a good sign. That means that the blood pressure is started recently and no organ damage has already occurred. Now it is important to make sure that the organ does not get damaged in the long run. So we have to make sure that the blood pressure is under control at all point of time. If at all you get diagnosed with blood pressure, you have to check for the associated cofactors as well, which are usually high cholesterols, diabetes, high uric acid, and something called as a metabolic syndrome. So basically we have to make sure that you're not having any other associated comorbidities. So if at all there is a high cholesterol or blood pressure, or diabetes or uric acid, we have to address those issues as well. As you're aware, on May 17th, we have the World Hypertension Day. This day is mainly to create awareness and to make sure that each of us know our hypertension, to create awareness about hypertension, risk factors, as well as medications. On this World Hypertension Day, make sure that you get your BP checked, get the BP checked of your near and dear ones. Thank you.